Hi, welcome to my channel. Dr. Erica here again. Please like, share, subscribe if you haven't already. Again, Dr. Erica Onikbola, PharmD, my main channel. This is a supplemental channel where I talk about disease states a little bit and then travel. I talk about delicious food recipes, biblical study and inspiration, how you can actually enjoy retirement life, semi-retirement life. I talk about life over the age of 40 for women, and I talk about encouragement. So do please like, share, subscribe if you haven't already. This is Dr. Erica, Pharmacist-n-Charge here on YouTube. Thank you for joining me. I want to continue with the healing journey, and I also want to be an encouragement from a biblical standpoint. I want to talk about side effects of medications that are usually typical for depression, for anxiety, for smoking cessation, what it takes to start your healing journey, where you may be in your healing journey, and what do you ultimately want to get out of the healing journey. So let's start. Again, I'm Dr. Erica. Thank you for joining me. I'm talking about non pharmaceutical approaches to the healing journey. Medications are typically used. Basically, if they are requested or the patient has been depressed for quite a while, or if they may be suicidal, or they may be interested in medications after a point where they feel like they've tried everything other than. So, medications are okay, but do understand that antidepressants typically take 4 to 6 weeks to take a full effect. Within that time frame, that initial time frame, you might experience side effects. You might experience suicidal thoughts. You might experience depression even further before you actually get better. Side effects can also be weight gain. Side effects could also be decreased sexual interest. It could also mean that a person will feel suicidal, um, GI upset. There are lists. The list goes on and on. Weight gain, even, and typically the time at which a patient will be on an antidepressant would be like 12 to 16 months. Some people that I've met as a pharmacist, retail pharmacist, have been on antidepressants for a couple of decades. So usually we want to encourage patients 12 months to 16 months to see if there's an actual um, improvement in their daily schedule, in their daily habits. Are they feeling, improvement on a scale of 1 to 10? How often are they feeling depressed? Um, so once they begin to talk with the counselor, speak with the psychologist, then they'll move forward with medications. My approach as a pharmacist, after seeing so much in the medical field, after seeing people not getting off their medication after lifelong depressed state behind an event that only, took could only have taken just a counseling session or a couple of counseling sessions and some behavioral habit changes, which could have prevented them from initially taking medications in the beginning. So, um, as a pharmacist, I'm not a psychologist, I'm not a counselor, but from my opinion and my healthcare experience, I want to share with you options that I would choose. Number one would be to speak with a therapist or a counselor who can interact with you to learn who you are as a person, learn your character, learn how they can help you or give counseling, or how they can give some suggestions as to how your day could be better, how your life could be better over time. Then I want to um, encourage behavioral habit changes. If you are a smoker or you're somebody who uses tobacco, then there are some options for you that may include nicotine replacement, that may include you not needing nicotine replacement at all. Then there are options that prescription options, there are non prescription options, and there are ways you can taper down off of tobacco use to help you to be healthier, feel healthier, know that you are uh, changing your behavioral habits for positive behavioral habits, and that your family will appreciate you discontinuing tobacco use. So, behavioral habits that you feel are hindering your progress, your walk in your healing journey can um, can be talked with a therapist or someone a healthcare provider or someone you can confide in, and that could be your pharmacist, that could be your therapist or your pastor of your Bible-based church. It could be a leader in the Bible-based church, someone that you can confide in that can give you all the information that you would need to heal and begin a healthy life. Now, antidepressant medications, there are newer ones on the market. There are some older, typical ones that are on the market still. But again, the side effects, I would not suggest any of them. But again, you have to talk with the prescriber. Um, just be encouraged that there are three options that I give. And the first one is to detach from bad habits that are encouraging you to feel down or feel sorrowful or feel like you're not worthy. Detach from things that abuse you or misuse you or contradict who you know you are and the skills and the knowledge of Christ that confirms to you who you are and what you can accomplish. It's also called fasting. Detachment and fasting are basically the same thing because you're removing yourself, your spiritual self, your physical self, your emotional self from temptation, from things that allow you um, to not be self-aware of your own autonomy, your own respect. So when you fast and when you detach yourself, you're able to think better. You're able to your body is breaking down fats, your body is breaking down toxins, waste products, all of the things that your body wants to rid always, but we're hindering our body from ridding of those things because we continue to consume. And when we consume, we can't naturally do what we need to do. Fasting is natural. It's just that some of us, as humans, we tend to not fast because of our career, because of our daily routine. We have to get up, we have to go here, we have to drop the kids off there, we have to be a part, we have to participate, we have to be involved. So we're always moving and going. And so the we don't have what it takes to fast. And when we calm down, when we slow down, live a simple life, remove some of the things that encourage us to move hastily, then we can enjoy the fast. Our body can break down fat cells, and our insulin can be more regulated properly, and our organ systems can breathe more. And we're built, our bodies are built to be healthy and to fast and to live a good 80 70 to 80 years. However, when we don't um respect our bodies, or when we don't acknowledge and take time out for our individual selves and we eat sugar and we consume sugary products, then yes, we are able to um, develop disease states more easily, and hospitalization, mortality, comorbidity, all of those things that work together and tear our bodies down. So nutrition is another step that we can take to better our healing journey. When we respect the ingredients that enter into our body and we know the benefits and we know the quantity, the portion sizes that we eat, when we regulate what our temple does, then that helps mentally uh, release dopamine neurotransmitters, serotonin neurotransmitters, all of those good neurotransmitter. Our brain lets us know that we're doing an excellent job, that we are on the right track, and that we are continuing in that manner. So nutrition plays a big part in um, our feel good area of the brain, because we know that we're eating good and we're doing the right thing. And although it can be meticulous reading nutritional label after nutritional label, once you begin to do that regularly, you become it becomes a habit for you and becomes easier for you, and you know your product at which you want to consume. Also, I want to suggest positive affirmations. Implementing those positive things into your life that helps you to become stronger, to remind you of things that make you happy, um, and also, like I mentioned in my other video of healing non-pharmaceutical approach, would be forgiving and apology. Once we forgive, once we begin to apologize, we begin to flow in life a lot easier, not operating off of guilt, not operating off of pain, not operating off of a grudge, not operating off of what could have been but did not happen for us, um, being offended by our teachers, or it could be a coach, or it could be someone who didn't give us the opportunity that we thought we should have gotten. So I mean, we just have to figure out the source of a lot of the things that hinder us, and then we move forward in a manner that will allow us 20 years from now to still be um, where we ought to be. So that's my approach. And if I could add, don't settle. Don't settle for what you don't want. If you pray for something and it turns out to be what you didn't actually think it would be, then seek God's face again. Don't be distracted by what no one says. Don't be distracted by what someone else is doing or not doing. Stay focused with like minded individuals, um, people that can help you, people who are there to help transform you and be a part of your future, is what I want to say. So don't settle. Don't settle for what you know is not right and what you actually deserve. Don't settle for what you don't deserve. So that's what I want to talk about on this healing journey, non pharmaceutical approach. And please like, share, subscribe as well. If there's any topics you want to hear about, anything you want to know about, let me know. And I hope to see you on future videos. This is Dr. Erica. I'm signing off. Take care. Bye bye.